Today is October 15th, 2025. In villages and cities across the globe, a quiet tragedy is unfolding. Half of all women who die from breast cancer live in the world's developing nations. This is not just a statistic, it is a profound injustice rooted in poverty and a lack of access to care that so many in wealthier nations take for granted. These are mothers, sisters, daughters, whose lives are cut short not by an incurable disease, but by the circumstances into which they were born. Their deaths are often preventable. We must confront this disparity as a moral imperative demanding immediate and sustained attention. This forces us to ask difficult questions about global health equity. Why does a woman's geographic location so heavily determine her chances of surviving a treatable cancer? The answer lies in the complex web of social, economic, structural barriers that stand between a woman and the care she needs. It reveals a global health system failing its most vulnerable members. Understanding this failure is the first step toward fixing it. We must look closer and refuse the notion that such outcomes are inevitable. Every life has equal value. The weight of this reality falls on entire communities. When a woman dies, the ripple effects are immense. Families lose their primary caregivers. The first great barrier contributing to the high death rate in developing nations is late diagnosis. This is not about personal negligence. It's a systemic failure. Many women simply do not know what to look for. The early signs of breast cancer are not common knowledge. Health education is scarce. Public awareness campaigns are rare. A culture of silence and stigma can stop women from speaking up. By the time a lump is large or painful enough to prompt a clinic visit, the cancer is often advanced and less treatable. The second barrier is lack of access to adequate treatment and care. Even if a woman seeks help, the services may not exist. Rural clinics often lack trained personnel. They may not perform a proper clinical breast exam. They certainly may not offer a biopsy to confirm diagnosis. The nearest hospital with surgical capabilities could be hundreds of miles away. Radiation facilities may be equally distant. Chemotherapy centers are often out of reach. Essential medicines may be absent. Reliable electricity for equipment may be missing. Trained oncologists may simply not be available. Patients are left with a diagnosis but no viable path to treatment. The third barrier is the crushing weight of cost and fear. Without public health insurance, financial toxicity is devastating. The cost of consultations can ruin a family. Diagnostic tests add up. Transportation to distant centers is expensive. Early detection is the most powerful weapon, especially in low-resource environments. Lives are saved not by expensive machines, but by finding disease before it spreads. Equip women and local providers with knowledge. The most common sign, a new lump in the breast or a lump in the underarm. These lumps are often painless. Absence of pain is not reassurance, beyond lumps. Other signs to know: change in size, change in shape, swelling in all or part of the breast, skin dimpling, like an orange peel, redness, scaliness, thickening of the nipple or breast skin, nipple turning inward, nipple discharge, other than breast milk, including blood, new, persistent pain in one spot of the breast or armpit. Move from abstract knowledge to concrete action. Practice breast self-awareness. Know how your breasts normally look and feel. Encourage women to see a health worker if they notice changes. Advocate for widespread availability of clinical breast exams. Show a trained nurse performing a CBE. CBE is low-cost, low-technology screening where mammography isn't feasible. CBE links, a woman's concern to formal diagnosis. Finding cancer early dramatically increases survival. Early disease may require only surgery and a short course of therapy. Advanced metastatic cancer requires complex, expensive long-term care often unavailable in poor countries. Saving lives from breast cancer in developing nations.